That was our new reporter who is joining us from New York. Thank you very, very much for compiling this report, Jean-Was. And now with this, we are going to be moving on from our first discussion, which was a very important one, which was about starting up a small-size business enterprise, to our next discussion, which no matter what is a problem of each one of us at some point in time, at some time of the year, especially at this time of the year. Joining us here to speak to us about colds, flus, the common signs and symptoms of it and such conditions is Dr. Adil Al-Tahlawi, and we are going to be having our discussion with him about how it is that we could understand them a little better and deal with them a little better. Assalamu alaikum, Dr. Adil, and welcome to the program.
Thank you for invitation.
Thank you for being with us, Dr. Adil, because at this time of the year, doctors like yourself are very, very much needed. All the ENT specialists and experts are the ones who are having long queues of patients waiting because this kind of weather calls for such kind of symptoms, and especially for the flu and the common cold.
Yes.
As we talk about flu and common cold, Dr. Adil, first of all, tell us as to how do we even understand if there is a difference between a flu and a cold?
Both flu and the common cold are upper respiratory tract infections. Both are contagious diseases. Both are droplet infection diseases. But many people think that both are the same, but there is a big difference. Viruses causing a common cold are not the same as viruses causing flu. There is difference in symptoms. Fever in flu may reach 40 or 41 degrees centigrade, but fever in common cold may be normal or just increasing by 0.5 or maximum 1 degree centigrade. Sneezing is common in case of common cold, but not common in case of flu. Throat pain is common in case of common cold, but not common in case of flu. Generalized bony ache, headache, discomfort, fatigue, all are common in case of flu, but not common in case of common cold. Most important difference is complication of common cold and the complication of flu. Complication of flu mainly affect the chest in the form of chest infection, in the form of acute bronchitis, acute bronchiolitis, pneumonia, bronchopneumonia. Sometimes in severe cases of flu may lead to respiratory failure. But complication in case of common cold, only otitis media and the sinusitis.
So flu is
danger.
Is worse than
more
common
severe.
cold.
Flu is more severe. Flu can cause sick leave, can cause employees for sick leave, can cause children school absence. But common cold, the patient can go work, can do his normal, ordinary life without any trouble.
Right, but when we talk about flu, so as you said that flu is the one that we need to know more about because it could be sometimes more critical as well. Now, how long is it that a flu cycle could last you?
Flu can continue up to 2 weeks.
Up to 2 weeks.
Up to 2
When
weeks.
should we go to a doctor?
Once the virus gets into the body, enters the body, after 24 hours, the patient is infectious, even without the appearance of symptoms and signs. Symptoms and signs can appear from 2 to 3 days.
Yeah.
And symptoms and signs can persist up to 2 weeks, or even in severe cases, 1 month.
Oh, okay. So 2 weeks to 1 month. In all of this, Dr. Adil, for the people who don't like to visit the doctor much, when is it time for them to know that now they should go to the doctor?
Many people go to the pharmacy and they take medicine.
Yeah.
And
It
some
is
people
called-
take
it is
antibiotic
called-
as well.
It is called over-counter medicine. No problem. If the condition for flu and common cold are self-limited, needs no treatment, just rest bed, just drink hot drinks, just orange juice. But if the condition persists more than 5 days, more than 1 week, the patient should seek medical advice to avoid complications.
So 1 week is the time.
Yeah, 1 week, and there is no treatment for flu. It's all about
The treatment is rest in bed, hot drinks, but the patient can take medicine for the symptoms.
the symptoms.